Hello and welcome to Africa Health Weekly, where we showcase Africa's health stories, 1 week at a time. I'm your host, Beverly Defoe. In today's episode, we cover major advances in surgery, health financing and insurance reforms, and urgent infectious disease responses shaping Africa's health future. Let's dive into this week's headlines. We begin in the Democratic Republic of Congo, where UNICEF reports the country is facing its worst cholera outbreak in 25 years. Since the start of 2025, more than 64,000 cases have been recorded, with nearly 1,900 deaths. Children account for over 14,000 cases and 340 deaths, representing nearly 1 in 4 infections. The outbreak, affecting 17 of the country's 26 provinces, underscores persistent challenges around access to clean water. Only 43% of the population uses basic water services, the lowest in Africa, and the urgent need for emergency response in conflict-affected areas. Staying with infectious disease control, Somalia launched its emergency diphtheria vaccination campaign from December 15th through the 20th. The country confirmed approximately 1,000 cases this year, with 50 children dying from the disease by early December. Health authorities are racing to close immunity gaps, particularly in the Banadir region, and prevent further loss of life among children aged 5 to 15 who have been most affected. There is better news from Sierra Leone, which officially declared the end of its mpox outbreak on December 15. Since January 9, the country recorded 5,442 confirmed cases and 60 deaths. All 16 districts have now gone more than 42 days without a new infection. A critical milestone that reflects sustained surveillance, community engagement, and the vaccination of over 186,000 people, prioritizing healthcare workers and vulnerable populations. As countries confront these public health pressures, major policy shifts are underway. In Tanzania, the Ministry of Health reports that preparations for the rollout of universal health insurance are now 80% complete, with benefit packages expected to be unveiled soon. These packages have been designed based on the country's disease burden and income levels, marking a significant step toward expanding financial protection and access to care nationwide. The initiative comes as health insurance coverage has remained at only 15.3% of the population. In Ethiopia, regulators have launched a national strategy to combat substandard and falsified medical products for the period 2026 to 2030. The strategy aims to protect patients from unsafe medicines and strengthen trust in pharmaceutical supply chains, an issue that affects health outcomes across the continent. Meanwhile, Cameroon and the United States have sealed a major health cooperation agreement worth approximately $836 million, alongside a domestic commitment of $450 million from the Cameroonian government. The deal is part of broader efforts to strengthen national health systems while increasing domestic responsibility for financing and delivery. In Egypt, the universal health insurance system continues to scale rapidly. The government has accelerated timelines for nationwide coverage and reports that the scheme has already delivered more than 250 million health services, including coverage for high-cost life-saving procedures such as an open-heart surgery, cochlear implants, and bone marrow transplants. Turning now to innovation and infrastructure, in Tunisia, history was made this week with the country's first robot-assisted kidney surgery performed at Charles Nicolle University Hospital. The successful procedure, supported by South Korean robotic surgery expert, signals Tunisia's entry into advanced surgical technologies and opens the door for wider adoption of robotic interventions in the region. In Algeria, the Ministry of Health has announced plans to launch a digital patient transfer platform designed to improve coordination between hospitals and reduce delays in emergency referrals, a long-standing challenge in national health systems. And in Mozambique, the government has unveiled plans for a major expansion of surgical and specialized care. Construction of the Maputo Surgical Center is set to begin in April 2026 alongside a new oncology institute and maternal and child hospital financed through partnerships with China and Brazil. These projects represent some of the largest health infrastructure investments in the country's history. Finally, we turn to the people who keep health systems running. In Ghana, the exodus of nurses continues to strain service delivery. While exact 2024 figures vary by source, an estimated 7,000 nurses have departed since 2022, with hundreds leaving monthly in search of better pay and working conditions abroad. The trend raises serious questions about sustainability, investment in training, and retention strategies in a country with only 3.6 working nurses per 1,000 people, despite boasting over 120,000 trained nurses. In Mozambique, ongoing strikes by health workers have prompted the government to reaffirm its commitment to paying outstanding overtime debts totaling nearly $13 million through a phased, sustainable approach. Those are the key health stories shaping Africa this week. For more detail, deeper context, and full stories behind these headlines, join our Africa Health Weekly newsletter. You can sign up at globalhealthunfiltered.com and get these updates delivered straight into your inbox. If you know a health story, innovation, or challenge that deserves the spotlight, email us at editor@globalhealthunfiltered.com. This week's show was researched by Ulrich Sidney Kamunye, fact-checked by Elwin Kwabena Dade, and produced by Desmond Jumba. I am Beverly Defoyne. Thank you for listening, and we'll be back next week.